welcome to the Deep Dive. Today, we're doing something a bit different, but I think incredibly insightful. We're plunging into the fascinating world of what it really means to be a health and safety advisor.
Right.
Our source material.
Yeah.
An actual interview guide for this exact role. Now, you might think, an interview guide, that's just, questions and answers.
Yeah.
But as we're about to discover, it's actually a gold mine.
Mm-hmm.
It helps us understand the critical mindset, the kind of layered thinking, and the incredibly diverse skill set that's absolutely essential for this vital role.
That's exactly right. Our mission here isn't just about giving you interview tips, though that might be a side benefit. It's really to extract the core nuggets of knowledge, the insights, helping you truly grasp why certain questions get asked.
Okay.
What employers are really looking for deep down and, how a top-tier safety professional actually operates day to day. We're basically turning what looks like a simple document into a kind of masterclass on workplace safety excellence.
Exactly. It's getting beyond the theory to the practical application of safety principles.
Yeah.
So let's unpack this. We should start with the foundational responsibilities, maybe, and the mindset that really defines a great health and safety advisor.
Sounds good.
And first up, how do skilled professionals proactively spot potential issues? Because it's not just about reacting when something goes wrong, is it?
Not at all, no. I think what's often misunderstood is that it goes way beyond just noticing, say, a misplaced box. The real skill lies in understanding the potential chain of events that a seemingly small issue could trigger, and anticipating how people might behave around it. For instance, the source mentions a cluttered storage area. A proactive advisor doesn't just see a mess.
Right.
They're picturing someone rushing through, tripping, falling, the potential for a really serious injury. They're looking at the root cause of that clutter. Maybe it's poor organization. Maybe there's no designated space, not just the symptom,
So the fix isn't just a quick tidy-up session then. It's about changing the system itself. The example points to actually organizing the space properly, adding clear signage, maybe even rethinking workflows slightly.
Precisely.
And the outcome? It's not just fewer incidents, which is great, but also a noticeable increase in safety mindfulness from everyone. It's about building that safer culture bit by bit.
Which brings us neatly to a constant challenge in this field.
Yeah.
Staying current. Regulations change, best practices evolve. Compliance isn't static, so the advisor can't be either.
No, definitely not. The source material really hammers this home, the need for continuous learning. It talks about things like regularly checking official websites like the HSE, the Health and Safety Executive in the UK, that's their main regulator, subscribing to industry newsletters, attending relevant training or workshops. There was a good insight mentioned about how even a webinar on something standard like workplace risk assessments can offer fresh perspectives, even for seasoned pros.
Absolutely.
It's about staying agile in what's a pretty dynamic regulatory landscape, right?
Absolutely. That agility is crucial. It gives you the confidence to advise properly. But, okay, what happens when you have identified a new safety measure, maybe based on new regs, and employees are resistant?
Yeah.
Managing that resistance, fostering cooperation, that's a huge part of the job. Often underestimated, I think.
This is where the people skills really come in, isn't it?
Yeah.
The guide emphasizes listening to concerns, like really listening and clearly explaining the why, the reasons, the benefits, not just laying down the law.
Right. Explain, don't just dictate.
Exactly.
Yeah.
And crucially, involving employees in the discussions where possible to get their buy-in. It's less about enforcing compliance from above and more about making people partners in their own safety. And the result, you ease that resistance, you build trust, and that ultimately improves compliance. What do you think is the toughest part of getting that buy-in?
Good question. I think often it's overcoming those ingrained habits. The we've always done it this way mentality.
Yeah, that's a classic.
It just requires a patient approach. You have to demonstrate how a new measure isn't just some bureaucratic inconvenience, but actually a genuine improvement for their day-to-day well-being, or maybe even their efficiency. Showing them, not just telling them.
That makes perfect sense, showing the what's in it for me. And speaking of drive, how do safety professionals keep themselves motivated, focused on the safety goals? And then how do they translate that personal commitment into motivating a whole team?
Well, on a personal level, I think it's often about connecting those sometimes abstract safety goals to tangible human outcomes. Realizing how a small change you pushed for might prevent a life-altering injury down the line. That kind of visceral connection that fuels your commitment. For motivating teams, the source suggests things like open conversations, talking about the challenges, but also the successes. Celebrating the small wins helps build momentum.
Yeah, recognition is important.
Definitely. And of course, leading by example. It's all about creating a positive, invested environment where safety isn't just a poster on the wall, but something everyone feels responsible for and valued in contributing to.
Okay, so let's get practical again. What are some of the most common hazards an advisor deals with day to day, and how are they typically managed effectively?
Well, the usual suspects often crop up: slips, trips, falls, and risks from manual handling. The process for managing these should be systematic. First, a thorough assessment of the work environment, spotting those potential risks.
Okay.
Then, crucially, ranking them, usually based on likelihood and severity. How likely is it to happen and how bad could it be if it does? That helps you prioritize.
Right, focus on the big stuff first.
Exactly. Then you implement practical controls, and ideally you follow what's known as the hierarchy of controls,
Yeah.
starting with eliminating hazard altogether if you can.
Right.
Then substitution, then engineering controls, administrative controls like procedures or training, and only then, as a last resort really, personal protective equipment or PPE.
Ah, the hierarchy of controls.
Yeah.
This is a fundamental concept. It
Right.
really elevates the thinking beyond just, put up a sign. It forces you to ask, how can we design this problem out?
Precisely. Can we make this floor not slippery in the first place, rather than just warning people it is?
Right.
And beyond those everyday hazards, a core function is conducting internal audits for regulatory compliance.
Okay, audits.
This is about making sure the whole organization isn't just aware of the safety standards, but is genuinely adhering to them consistently.
So it's like a systematic checkup on the organization's safety health. The steps involve defining what the audit will cover, the scope, preparing specific checklists, and then gathering evidence. That could be through observations, talking to people, reviewing documents.
Yeah.
But what's crucial, as this source points out, is it's not just about finding faults. It's compiling clear, straightforward reports, highlighting any gaps, and then this is key, collaborating with the teams on corrective actions.
Right.
It's a cycle, right? A continuous improvement loop.
It absolutely has to be, yeah. And moving from identifying issues to implementing solutions, a key indicator of a really strong health and safety advisor is their ability to lead successful initiative. Projects that actually drive safety improvements.
Yeah, demonstrating practical experience in leadership. The source gives a great example. Leading a project to cut workplace slips by 40% in 6 months.
Wow, 40%. That's significant.
It is. And it wasn't just about, telling people be more careful. It involved concrete things. Improving floor maintenance, updating the cleaning protocols, running brief but effective staff awareness and training sessions. It shows how you get tangible results by combining practical changes with genuine engagement. It's making that cultural shift happen.
And often these initiatives aren't happening in isolation, are they? How does a safety pro juggle, say, multiple health and safety projects at the same time? Prioritization must be vital when things get busy.
Oh, absolutely. This is where you need to assess the urgency and the level of risk for each project. The strategy discussed involves breaking down those bigger tasks into smaller, manageable steps, setting clear milestones along the way, and having regular check-ins with the teams and any other stakeholders.
Right, keeping everyone in the loop.
Exactly. The example given is balancing safety audits and ongoing risk assessments by deliberately focusing on the highest risk areas first. It's about being efficient without cutting corners and being upfront if resources get stretched or timelines need adjusting.
Makes sense. And sometimes those projects might hit bumps internally. How does a safety professional handle disagreement within a team? Maybe about a new safety practice or procedure.
Yeah, conflict resolution is a surprisingly big part of it. The advice is to listen calmly, objectively, to all the different viewpoints. Create that space for open dialogue where people feel they can actually speak up. Then the advisor's role is to gently guide the team towards alignment with clear regulations and established best practices, often framing it as, this is a standard we all need to meet for everyone's benefit. The guide mentions facilitating a discussion that helped colleagues agree on a new procedure.
How did they do that?
By really highlighting the universal benefits, addressing the specific worries people had, and essentially turning that potential conflict into a collaborative problem-solving session. It's a crucial soft skill, sometimes trickier than the technical stuff.
I can imagine. Speaking of practical experience, what about direct involvement with audits and inspections? Not just planning them, but doing them. What's the value of that hands-on experience?
It's about developing that keen eye, isn't it? That intuition. The source talks about advisors regularly carrying out inspections across different sites, spotting potential risks, maybe things others have walked past, discussing the findings with the team right there, and suggesting practical improvements. Well, A small but good anecdote mentioned was spotting a minor electrical hazard during a routine walkthrough, something simple, maybe a frayed cable or an overloaded socket, and getting it addressed immediately before it could escalate into something serious. It's that constant vigilance that prevents bigger problems.
And when an incident does happen, despite best efforts, then thorough investigation and reporting become absolutely paramount. This isn't just about filling out forms, is it?
No, definitely not. It's fundamentally about prevention, learning from what went wrong. The process involves meticulously collecting all the relevant details, witness statements, photos, checking equipment logs to build a really clear picture of what happened.
Okay.
Then the critical part, digging deeper to understand the root causes. Not just the obvious trigger, but why that trigger existed. Using techniques like the 5 whys, where you keep asking why to peel back the layers.
Ah, yes, the 5 whys. Simple but effective.
Exactly, until you get to the fundamental issue. And finally, carefully recording those findings, and crucially, sharing them appropriately with the team, with management, so that lessons are genuinely learned and acted upon. It feeds back into that continuous improvement culture.
Which links directly to the next point. Making quick decisions to prevent safety incidents before they happen. This really tests how well someone can assess risks under pressure and act decisively.
Yeah, think about this scenario from the guide. Spotting a loose scaffolding plank during a site inspection. High up, potentially dangerous.
Right? Immediate risk.
The example describes the advisor quickly assessing the situation, the height, the potential fall zone, who's working nearby, then immediately halting work in that area and coordinating with the right people to get that plank secured safely. It's that blend of sharp observation, rapid risk assessment, and clear, decisive action. Not panicking, but acting with purpose.
That's a great example. Beyond reacting to immediate risks, though, training programs are fundamental for a proactive safety strategy. What kind of safety training should a professional be familiar with, and how do they implement it well?
Well, the source mentions the common essential ones: manual handling, fire safety, risk assessment training. But the key is that the approach shouldn't be generic, one size fits all.
Right, tailored.
Exactly. It's about assessing what the specific team needs and then designing sessions that are interactive and practical. The guide gives an excellent example for manual handling training. Not just showing slides, but actually using real equipment for people to practice safe lifting techniques.
Hands-on makes a difference.
Huge difference. That practical application helps reduce injuries far more effectively, and it builds people's confidence in doing the task safely. It shifts training from being a box-ticking exercise to becoming a genuinely useful skill.
But as we touched on earlier, not all safety rules are instantly popular. How does an advisor go about enforcing a necessary rule that maybe the team finds inconvenient or, well, unpopular? This is where balancing compliance with team dynamics becomes a real art form.
It truly is an art. You have to communicate the reasons really clearly, often linking the rule directly to real incidents, maybe near misses, or actual injuries that have happened elsewhere, or even within the company. Show the why.
Make it relevant.
Precisely. The example details introducing a stricter personal protective equipment, or PPE, policy that some people found inconvenient.
Yeah.
The advisor handled it by, first, listening to those concerns properly. Then, where possible, adjusting minor details, maybe ensuring the new PPE was actually comfortable or easily accessible.
Okay, so some flexibility.
A little where feasible without compromising safety. But then consistently reinforcing the benefits, why this protects them, their well-being, their colleagues. It's about building understanding and aiming for long-term compliance because people see the value, not just forcing it short-term.
That often requires some creative thinking, doesn't it? Can you give an example of a more innovative, perhaps less conventional solution someone might implement to improve workplace safety?
Yeah, the source has a fantastic example here. It describes introducing a simple safety snapshot board in a busy warehouse environment.
Okay, what's that?
Basically, a whiteboard where staff could quickly jot down daily safety observations, anything they noticed. A loose cable, a small spill, maybe a new process that felt awkward or risky.
Ah, low barrier to reporting.
Exactly. It encouraged really open communication, helped spot potential hazards super early, and fostered this culture where everyone felt responsible for looking out for safety. And the result? Fewer incidents, apparently, without adding loads of extra formal reporting tasks. Simple, visual, effective. A cultural nudge.
That's clever. And underpinning all these actions, of course, is ensuring consistent compliance with the actual regulations. The source focuses on the practical approach, staying updated on HSE rules in the UK context, conducting those regular risk assessments, providing tailored training.
Yes, The example cited there was implementing monthly safety briefings. Not long, maybe 15 minutes, but regular. And they found it helped reduce incidents because it kept safety top of mind, encouraged open chat about concerns, and promoted that continuous vigilance.
So it's about embedding it.
Exactly. Making it part of the normal routine. It's a dynamic, ongoing process, not a static target you hit once.
Okay, shifting gears slightly to more complex scenarios. How does an advisor approach solving a safety problem that involves multiple stakeholders,
Ah,
management, workers, maybe contractors, all with potentially different priorities?
yeah, that's where things get tricky. It really involves understanding the full, intricate picture first. That means gathering insights from all the relevant parties, listening to the workers on the ground, understanding management's constraints, talking to contractors, maybe even suppliers.
Getting the 360 view?
Precisely. And ensuring open, transparent communication throughout the process is key. So you can align everyone's concerns, find that common ground. The goal is to work collaboratively towards action plans that are practical, achievable, and, of course, compliant. The example of streamlining a site's emergency procedures, getting input from both internal staff and external contractors,
Yeah.
that demonstrates how you can find that shared purpose. Everyone wants emergencies handled smoothly, even when perspectives initially differ. It's almost like being a safety diplomat sometimes.
A safety diplomat. I like that. And that collaboration has to extend outwards too, especially to contractors and subcontractors. How does an advisor make sure they are complying with health and safety rules when they aren't direct employees?
Good question. It really starts before they even set foot on site. Clear communication of your expectations, your site rules, before work begins. Often reviewing their safety plans, their risk assessments in advance.
Due diligence upfront.
Absolutely. Then it's about having a presence. Regular site visits, not just to check boxes, but to observe, talk to their teams, spot potential issues early. And fostering open dialogue is crucial here too. Contractors should feel they can raise safety concerns with you without fear of negative consequences.
Right, a partnership approach.
Yes, the example given was identifying and collaboratively fixing a potential hazard on a project with the contractor, which avoided potential injury and costly delays. It's about building a trusting professional relationship, not just an adversarial compliance check.
And all this needs backing up. Legal compliance and meticulous attention to detail also mean handling regulatory reporting and documentation effectively. This isn't just admin work, it's a critical safety safeguard, isn't it?
Oh, absolutely critical. This involves preparing detailed reports, maybe for incidents or audits, ensuring they meet the standards required by bodies like the Health and Safety Executive in the UK. It means keeping thorough, accurate, and easily accessible records of everything: incidents, near misses, risk assessments, training.
The paper trail matters.
It really does. And it includes being able to communicate directly and clearly with inspectors when they visit. It's all about fostering transparency and cooperation with regulatory bodies, showing that you're organized, accountable, and proactive. Good documentation isn't just reactive. It's a proactive tool for managing safety.
Okay, let's circle back to a foundational skill: conducting risk assessments. What key factors are considered in that thorough, structured process?
It's a really systematic approach. You start by methodically spotting anything in the workplace that could potentially cause harm. That's your hazard identification. Could be physical things, substances, work processes, even psychological factors sometimes. Then for each hazard, you evaluate two things. How likely is it that someone could be harmed, and how severe would that harm likely be? We often use a risk matrix for this, plotting likelihood against severity, which helps prioritize which risks need tackling most urgently. Okay, prioritize based on risk level.
Exactly. After that, you decide on and implement appropriate control measures, using that hierarchy of controls we talked about. That might mean improving training, updating equipment, changing a work procedure, putting in guards, better ventilation, whatever fits. The example given was prioritizing fixing slippery floors in a warehouse. Seems simple, but if falls are frequent or could be severe, it becomes a high-impact fix. And in today's world, things change fast. Regulations shift, new technologies come in, policies get updated. How does a good advisor adapt quickly to those changes?
Agility is absolutely key. The example given in the source is perfect, actually. Yeah. Thinking about when the new COVID-19 guidelines suddenly came out.
Yeah, that was a huge one.
Massive. A good advisor had to quickly get to grips with those new requirements, review and revise all relevant risk assessments and safety protocols practically overnight, communicate those changes clearly across the entire organization, and ensure they were implemented swiftly and effectively, all while keeping the business running safely. It really highlights that need for adaptability under pressure.
Definitely tested everyone. Moving into crisis management territory, what kind of experience is important when it comes to emergency response planning and execution?
This is really about practical, hands-on knowledge. It's not just writing a plan and sticking it in a drawer. The source emphasizes having specific roles in creating emergency plans, sure, but also in practicing them running drills, simulations, and potentially leading the response during an actual emergency.
Right, coordination.
Yeah, including coordinating smoothly with external emergency services when they arrive. It's about leadership under pressure, clear communication when things are chaotic, and ensuring everyone knows their role. Preparedness is everything.
And after incidents or even near misses, the next vital step is analysis, looking for patterns. What methods are used to analyze accident data and identify trends? This moves beyond just fixing one problem to preventing future ones systemically.
Yeah, this is where safety gets really data-driven. It's a systematic process. Collecting comprehensive reports on incidents and near misses, organizing that data effectively, maybe using spreadsheets or, more likely these days, dedicated safety management software.
Okay.
And then you actively look for patterns. Are there recurring causes? Specific types of incidents happening more often? Are they clustered in certain locations or times? Spotting those trends is crucial.
And what do you do with those trends?
Well, those insights then drive targeted changes. For example, if you see a pattern of slips in a particular corridor, maybe that leads to improved signage there, better lighting, or a change in floor surface or cleaning regime. It's about using data intelligently to predict where the next incident might happen and prevent it.
Makes sense. Using data proactively. Now, perhaps one of the most challenging but crucial aspects, persuading senior management to actually invest in health and safety initiatives. This often requires identifying risks, but communicating their impact in a way that resonates upstairs, often in financial or operational terms.
Exactly. You really have to learn to speak their language. The strategy outlined is, first, gather robust data. Hard facts. Present clear evidence not just on potential injuries, but also the associated costs.
Like what kind of costs?
Well, direct costs like potential fines, insurance premium hikes, compensation claims, but also indirect costs like lost productivity, damage to equipment or reputation, impact on staff morale.
Okay, building the business case.
Precisely. But it's not just about the negative. It's also crucial to focus on the practical solutions you're proposing and the positive impact. Improve staff well-being, better morale, maybe even enhanced productivity or retention because people feel safer and more valued. The example given was getting support for new non-slip flooring.
Yeah.
The argument likely wasn't just it's safer, but probably included data on previous slips, potential costs avoided, and maybe even a boost to efficiency in that area. It's about demonstrating the return on investment, both human and financial.
That's a really key skill. Finally, wrapping up the core technical side, what are the key components of an effective health and safety management system overall? This is about understanding the structured approach to workplace safety.
Right, the big picture framework. At its core, an effective system includes clear, accessible policies and procedures. Robust risk assessments are fundamental. Then, regular, relevant, and effective training keeps everyone skilled and aware.
Okay.
Open communication channels up, down, and sideways are vital for reporting concerns and sharing information. Crucially, there needs to be a mechanism for ongoing improvement, usually driven by diligent incident investigations and regular reviews or audits. And underpinning everything, it must align with legal standards, like the Health and Safety at Work Act in the UK. It's a holistic, living framework, not just a set of documents. It aims for continuous improvement in safety culture and performance.
That's a great summary of the core elements.
So we've really dug deep into the technical skills, the practical knowledge, the mindset that defines a top-tier health and safety advisor. But as we know, an interview isn't just about listing what you know. It's about how you demonstrate that knowledge, that mindset, those crucial soft skills. Let's talk a bit about how these core H&S capabilities actually show up when you're, under the interview spotlight.
Absolutely, because even those common general interview questions take on a specific meaning in this context. For example, when an employer asks about, say, your biggest strengths,
Yeah.
they're not just looking for generic answers like, I'm a hard worker. They want to hear strengths that directly apply to being an effective health and safety professional. Maybe it's your meticulous attention to detail, perhaps your ability to communicate complex safety information clearly to different audiences, or your structured approach to problem solving.
Right, connecting it back to the job. Or that classic question, why did you leave your last job? It's not just about your career history, is it? It's about how you frame it.
Exactly. It's a test of professionalism, really. You want to demonstrate that you're seeking positive things, new challenges, growth opportunities, perhaps a role that aligns better with your passion for promoting a strong safety culture rather than sounding negative about a previous employer. It shows forward momentum.
And what are your plans for continuing professional development? That links right back to what we discussed earlier about staying current, doesn't it?
Precisely. They're probing your commitment to ongoing learning in a field that constantly evolves. So, talking about specific conferences you hope to attend, certifications you're pursuing, like NEBUSH or IRICH qualifications, perhaps, or even just mentioning industry journals or websites you follow regularly shows you're genuinely invested in your growth and staying at the forefront.
So even what might seem like a standard question about handling multiple responsibilities.
Becomes a perfect opportunity to highlight your prioritization skills, but specifically in the context of safety. How do you assess urgency and risk across different safety projects or tasks? How do you stay organized when juggling audits, training, and incident follow-ups in potentially fast-paced environments where safety is always paramount?
And lastly, that common one. Tell me about your experience working in a team.
Again, it's tailoring time. This is your chance to give concrete examples of collaboration, effective communication, and how you've contributed positively to shared safety goals. Maybe how you worked with colleagues and management to reduce incidents in a particular area, or how you helped to get buy-in for a new safety procedure. Show, don't just tell.
Okay, makes sense. Let's talk about the homework, company research. It seems obvious, but why is it so crucial to go beyond just a quick glance at their About Us page?
Well, firstly, deep research shows genuine interest. It signals you're serious about the specific role at this specific company, but more importantly, it allows you to tailor your answers effectively. On their company website, don't just look at the mission and values. Actively search for any specific health and safety information they publish. Do they have reports, case studies, blog posts about safety initiatives? How do they talk about their safety culture, if at all? Look for clues in their annual reports, maybe white papers.
And what about looking at their social media presence?
Social media like LinkedIn, Twitter, maybe even Facebook or Instagram, depending on the company, can give you a real feel for their culture, their values in action, how they present themselves publicly. LinkedIn specifically is great for understanding company structure, maybe seeing who's already on the safety team, their backgrounds. You're looking for patterns, recent news, the general vibe.
And understanding the broader industry context, news and trends.
Yeah, that helps you speak intelligently about the world they operate in. What are the big regulatory challenges in their sector right now? Are there new technologies impacting safety? What are considered best practices? Using reputable industry news sources helps you understand their landscape.
And finally, competitor analysis. Why look at their rivals?
It helps you understand the company's unique position in the market, their potential pressures, their competitive advantages. Knowing this helps you frame how your role in ensuring safety and compliance contributes to their overall success and strategy. It shows strategic thinking.
Right. Now for the slightly more unpredictable part, curveball questions,
Yeah.
those ones that seem totally random, like, if you were an animal, what would you be? But they're not random, are they?
Not at all. They're actually quite clever ways to assess things like creativity, problem solving under pressure, core values, and general personality fit. They see how you think on your feet. Like your example, if you were a superhero, what would your superpower be and why?
With a good safety-focused answer there.
Well, something relevant. Maybe the ability to instantly foresee potential risks and hazards before they actually happen. It's creative, but directly links back to the proactive nature of the role.
Okay. Or, if you could have dinner with any historical figure, who would it be and why?
This taps into your interests and values. For a safety role, choosing someone like, say, Florence Nightingale, focusing on her dedication to improving healthcare standards, hygiene, data analysis, and public health, shows a clear alignment with the core principles of the field.
Makes sense. If you were stranded on a desert island, what 3 items would you bring?
Pure problem solving and prioritization test. Choosing practical, survival-focused items, maybe a water purifier, a sturdy, multi-purpose tool, and perhaps a satellite phone for rescue, demonstrates a logical, safety-first mindset, even in an abstract scenario.
If you could live in any time period, past or future, which would you choose and why?
This explores your interests, maybe your imagination, choosing perhaps the Industrial Revolution era, not for the romance, but to witness firsthand the emergence of workplace hazards and the beginnings of safety regulations, shows a deeper historical interest in the field's evolution.
That's a good one. And lastly, if you could switch lives with any fictional character for a day, who would it be and why?
This can reveal creativity, empathy, maybe aspirations. Choosing someone known for intelligence, resourcefulness, and perhaps a strong sense of justice or problem solving, maybe like Hermione Granger from Harry Potter, citing her ability to research, think critically, and stand up for what's right reflects qualities valuable in a professional setting, especially one involving complex rules and ethical considerations.
You see, all these questions, even the ones that seem a bit playful or odd, are actually designed to give interviewers a much deeper understanding of you beyond the CV. Your underlying values, how you process information, how you approach unexpected challenges.
Exactly. It's about the person behind the qualifications.
And finally, just a brief but I think critical point on presentation. What to wear to the interview. It's not about fashion, is it? It's about projecting professionalism that aligns with the seriousness of the role.
Absolutely. Keep it professional. Generally, business casual is a safe bet unless you know the company culture is more formal. Think neutral colors, black, navy, gray, white. A well-fitted suit or maybe a blazer with smart trousers or a skirt paired with a clean iron shirt or blouse.
And the small details matter.
They really do. Avoid anything too flashy accessories, jewelry. Make sure your shoes are clean and polished. Keep makeup and hairstyle neat and professional. Avoid strong perfumes or colognes. Some people are sensitive. And the absolute basics. Make sure your clothes are clean, neat, and wrinkle-free. It all contributes to an impression of meticulousness, respect, and attention to detailed traits you definitely want in a health and safety advisor.
Yeah, every element kind of reinforces the message you're trying to send about your professionalism and competence.
Exactly. It completes the picture.
Well, I feel like we've taken a really comprehensive deep dive into the world of a health and safety advisor today. We've pulled apart what it truly means to excel in this field. Everything from that proactive hazard spotting and complex problem solving, right through to leading teams and even handling those curveball interview questions.
Yeah, it's been quite thorough. And hopefully this deep dive wasn't just about, prepping for a specific conversation. The aim was really to equip you, the listener, with a more holistic understanding of what safety leadership involves, the critical thinking, the communication, the resilience that makes a real difference in keeping people safe at work.
Absolutely. So, to leave you with something to think about, as industries continue to evolve so rapidly, think about the increasing integration of AI, more automation, the rise of remote and hybrid working. Consider this.
Mm.
How might these trends introduce entirely new categories of, let's call them unforeseen safety challenges?
That's a big question.
It is. What proactive measures, what new adaptive skills might a health and safety advisor of the future need to master to really stay ahead of these emerging risks? Something to chew on.